Well, hello everyone, and this is the third installment in our GI medications section. So this is Antiemetic and Antinausea Drugs. Here we will be discussing those medications which affect vomiting and nausea. Of course, a little bit of definitions for you. So nausea is that unpleasant feeling that often precedes vomiting. Any of us that have vomited know what this feels like. Emesis is the forceful emptying of gastric and occasionally intestinal contents. And antiemetic drugs are used to relieve nausea and vomiting. All right, so how we vomit is quite interesting. So here's a simplified explanation. So there is a vomiting center in the medulla oblongata of the brainstem, and that coordinates the act of vomiting. Basically, it receives signals from various sources like the GI tract, vestibular system for balance and motion, the higher brain centers, and the chemoreceptor trigger zone. And the chemoreceptor trigger zone is in the area posterna near the brainstem outside of the blood-brain barrier. So this detects toxins and chemicals in the blood and the cerebrospinal fluid. So when that detects a harmful substance, it sends signals to the vomiting center to trigger vomiting. So basically, the chemoreceptor trigger zone acts as a lookout for toxins and sends an alert to the vomiting center, which coordinates the process of vomiting to expel those harmful substances in the body. So once that happens, the actual vomiting process, I think, is quite interesting. So basically, the trigger and the signal to the brain, eventually the body prepares. So the body prepares for vomiting by taking a deep breath to prevent vomit from entering the lungs. The diaphragm and the abdominal muscles then contract, creating pressure. The epiglottis then closes off the windpipe to prevent inhalation of vomit, and the lower esophageal sphincter relaxes, which allows the contents of the stomach to move upward. And then the abdominal muscles forcefully contract, and then the contents of the stomach are expelled through the mouth. So this coordinated series of events helps protect the body from harmful substances, but also can be triggered by non-harmful things, right? And that's where we come in. That's where medications come in, because it would be great if that's all we did was, vomit up something horrible that we ate. But people vomit for all sorts of reasons, and as a result, we can lose fluids, and our bodies are really dependent on a fluid electrolyte balance, and we can basically go into metabolic alkalosis and lose our potassium, all sorts of reasons. So vomiting, while protective, can work against the patient. All right, so there are different types of nausea and vomiting I think we should be aware of. So there's chemotherapy-induced nausea and vomiting, which is caused by chemotherapy drugs, which are used to treat cancer. It can be anticipatory before treatment, acute, which is within 24 hours of treatment, or delayed, or even breakthrough. So breakthrough means despite giving prophylactic medications, and then refractory, which is unresponsive to treatment. So nausea is more common than vomiting, but the symptoms can be severe and debilitating. So treatment of this one requires specific antiemetic medications tailored to the emetogenic potential of the chemotherapy regimen, so how likely it is to force the patient to vomit. So postoperative nausea and vomiting is caused by anesthesia and surgical procedures, which typically occurs within the first 24 to 48 hours after surgery. Nausea and vomiting are common, often occurring together, and the treatment is usually aimed at prophylactic antiemetics and then rescue treatment if that fails. Now, general nausea can be due to a variety of factors, including GI infections, food poisoning, motion sickness, so basically everything else falls into here. Then it can occur at any time and is not necessarily linked to a specific event or treatment. Nausea may or may not be accompanied by the vomiting. And then basically you have to treat the underlying cause, and that might mean things like dietary changes, medications, and lifestyle modifications. All right, so here's our list of all the different medications that we use to treat emesis and nausea. And we'll go through them, but mechanism of action is really different, basically depending on what it's actually doing, but most do block one of those vomiting pathways. So if they take away the stimulus that induces a vomiting, then the patient does better. So indications: basically prevention and reduction of nausea and vomiting. So let's go into our specific classes here. So we've seen anticholinergic drugs being used for a variety of purposes, and here they are being used to stop nausea and vomiting by blocking the action of acetylcholine. So that neurotransmitter does play a key role in the vomiting reflex. So this is how it works. Basically, the anticholinergic drugs bind to the muscarinic acetylcholine receptors in the brain and the GI tract, which prevents the acetylcholine from binding. And by blocking acetylcholine, these drugs then reduce the nerve signals that trigger nausea and vomiting. They also reduce secretions in the GI tract, which can help alleviate nausea, and they relax smooth muscles in the GI tract, which reduces spasms and discomfort. So common anticholinergic drugs used for nausea and vomiting include scopolamine, which is often used for motion sickness, and a dimenhydrinate, which is Dramamine. So Dramamine tends to make people sleepy. Scopolamine is often, it's a transdermal dose. It's good for 3 days, usually behind the ear. This is the one you'll see all the folks who are motion sickness sufferers on cruises. You'll see them all wearing. It's part of their resort wear. All right, so transderm scopolamine. We'll also use it for the other anticholinergic effects in people who have excessive drooling and things of that nature. So it's pretty interesting. All right, so you can see on here, in the last slide I said that Dramamine is an anticholinergic drug. It's technically kind of both. It's an antihistamine with anticholinergic properties. So it does have the drowsiness aspect, but it's often lumped into those anticholinergics. All right, so the antihistamine drugs, these help stop nausea and vomiting by blocking histamine receptors in the brain and in the vestibular system. That's the part of the inner ear that helps control balance. And basically, these antihistamines, think meclizine, which is Antivert, they block the receptors in the brain, the H1, and histamine can trigger nausea and vomiting when it binds to those receptors. And then the vestibular system sends signals to the brain about balance and emotion. So antihistamines can calm these signals, reducing motion sickness. And then by reducing the excitation of the vestibular nerves, antihistamines help prevent nausea and vomiting that's associated with motion and balance issues, which is why you'll see this class of medications highly used for something like Meniere's disease. So these medications treat things like motion sickness and vertigo, but they also do have a mild sedative effect, which can help reduce the sensation of nausea. So remember our safety considerations with those medications which make patients drowsy. These are often used as well, like hydroxyzine or Vistaril, for its sedative effects for patients with mental health concerns. All right, so the antidopaminergic drugs, which are also known as dopamine antagonists, help stop nausea and vomiting by blocking dopamine receptors in the brain and in the GI tract. So these bind directly to the dopamine receptors, especially the D2 receptors, without activating them. So it prevents the dopamine from binding and exerting its effects. So by blocking dopamine, these drugs reduce the nerve signals that trigger nausea and vomiting. And remember, the chemoreceptor trigger zone in the brain is very sensitive to dopamine, so blocking dopamine here helps prevent the initiation of the vomiting reflex. So some of the common medications are prochlorperazine, which is compazine, which again, these are often used for some of our mental health disorders. Droperidol is one of those medications you may or may not see. So basically, it has been the subject of controversy because it has the potential to prolong the QT interval and also cause torsades, which is a very dangerous type of heart rhythm disorder. And in 2001, the FDA issued a black box warning on it with concerns about that QT interval, and that caused it to be less clinically relevant. And then some studies and some experts then argued that low doses were safe and effective for nausea and vomiting, especially during surgery. And they said that the data was based on basically higher than recommended doses. So despite this controversy, It's been reintroduced into the market, and some ERs, some surgical centers do use it cautiously, so you may see it, but it's not widely used. I wanted to draw your attention that I just did a little bit of layout on here that promethazine, we should have a hanging indent to let you know that promethazine, it's recommended by mouth and IM. IV is common, but it's not preferred, and it's never intra-arterial. All right, so the neurokinin receptor antagonists, or NK1s, they are a class of drugs that help stop nausea and vomiting, particularly associated with chemotherapy. They're often used with the serotonin blockers and glucocorticoids. But basically, they block the action of substance P, which is a neurotransmitter that binds to this NK1 in the brain and the GI tract. And that substance P plays a key role in triggering nausea and vomiting. By blocking these drugs prevent substance P from stimulating the vomiting center. And they're really effective for acute and delayed phases of chemotherapy-induced nausea and vomiting. You'll know these. I always think of these as the elephant drugs because it makes me think of elephant at the end, but it's aprepitant and fosaprepitant. So I don't know why I say that for the two, but I think the worst kind of and maybe biggest kind of nausea and vomiting is that chemotherapy-induced nausea and vomiting, so I think of it like an elephant. Anyways, we'll move on. All right, so let's look at the prokinetic drugs, of which metoclopramide or Reglan is going to be your exemplar drug here. So these drugs stop nausea and vomiting by increasing GI motility, and they basically do that by stimulating the muscles in the GI tract to contract more frequently and with greater strength. That helps move the food and fluids through the digestive system more efficiently. So they do this. So like metoclopramide basically stimulates the release of acetylcholine, which promotes the muscle contractions. Some inhibit acetylcholinesterase. Some activate the serotonin receptors. And some increase gastric emptying. But in general, they speed up how fast the stomach moves and how much it releases its contents. So they promote the movement of substances through the GI tract. Something interesting here for metoclopramide, the use of metoclopramide is contraindicated in patients who have a hypersensitivity to procainamide. So very interesting. That is because the metoclopramide can decrease the metabolism of the procainamide, which leads to higher than desirable levels of that drug, which can result in some really bad cardiac dysrhythmias. So serotonin blocker drugs, they're also known as the 5-HT3 receptor antagonists, but trust me, you'll never remember that. We just know them as serotonin blockers, of which the most common that you'll see is probably ondansetron or Zofran. So I put a little picture of it there. It's my cute little guy there with the green cap, so that is the one I like to use the most in the hospital. So basically they stop nausea and vomiting by blocking the serotonin receptors in the GI tract and in the chemoreceptor trigger zone in the brain. So basically they block the receptors, and since serotonin is a neurotransmitter that can trigger nausea and vomiting, when it binds there, that's important to us. And then serotonin blockers prevent the stimulation of the vomiting center. And then these drugs are particularly effective in preventing both acute and delayed phases of chemotherapy-induced nausea and vomiting. Diarrhea is an adverse effect of these. And also for ondansetron, FDA has issued warnings about the potential for QT prolongation with ondansetron. So there's a higher risk with the IV administration and higher doses. And so folks with underlying heart conditions, low potassium, magnesium, or taking other meds that prolong the QT interval are at higher risk. So this is why when a patient is ordered these meds, we generally need to have a baseline EKG on them so we know what their QT interval is. All right, so the tetrahydrocannabinoids. So this is basically THC. They help stop nausea and vomiting by interacting with the endocannabinoid system. Basically, THC binds to the receptors CB1 and CB2 in the brain stem and the GI tract, And by activating those receptors, it can modulate the release of these neurotransmitters, serotonin and dopamine, which we keep seeing as are indicated as to what they do for nausea and vomiting, and the vomiting reflex. And then that modulation helps reduce the sensation of nausea and the urge to vomit, making this a pretty effective form of chemotherapy-induced nausea and vomiting treatment. In fact, my sister just had a surgical procedure where they made her sign consent to get this medication, but they did give it to her for her post-op nausea, and it worked wonderfully. So dronabinol or Marinol is used for the treatment of nausea and vomiting associated with cancer chemotherapy. It's generally second-line drug after other antiemetics has failed, but it's also used to stimulate appetite and weight gain in patients with AIDS and patients who, of course, are on chemotherapy because, colloquially speaking, THC increases the munchies. So it can increase their appetite. All right, so Emetrol, so phosphorated carbohydrate solution, works to alleviate nausea and vomiting through direct local action on the GI tract. So basically it's hyperosmolar, meaning it has a high concentration of sugars, and that solution then draws water into the GI tract, which helps reduce the contractions of the smooth muscles. And by reducing those contractions, it helps alleviate nausea and vomiting. It's safe for most people, and in fact, tends to be used for morning sickness. The only people that it's really not safe for is, of course, people with diabetes because of the high sugar content, and then those with hereditary fructose intolerance because of the sugar. All right, so let's take a look at ginger. Now, often we have ginger ale in the hospital. I got to tell you, I don't think that has enough ginger to actually do anything, but people like it, so we keep it, right? So ginger is a well-known natural remedy for nausea and vomiting. It appears to inhibit serotonin receptors and also has anti-inflammatory properties, and also increases the movement of food through the digestive tract, which can help with nausea. So while often used to treat morning sickness, it should be used with caution during pregnancy. So high doses can increase the risk of a miscarriage. It may also increase the risk of bleeding. So it should be used with caution if the patient has a bleeding disorder or is taking any blood thinning medications. It can interact with anticoagulants, antiplatelets, and some antihypertensive agents. And some people may be allergic to ginger. All right, in general now, some nursing implications. Make sure you do a thorough assessment of your patient, including their complaints and their history, medications, interactions, possible contraindications. Some of the medications can cause severe drowsiness, especially our anticholinergics. They should not be used with CNS depressants if you're giving one that already depresses the CNS. Orthostatic hypotension teaching. So this means that our folks are at risk for falling, right? Anything that can decrease blood pressure. And again, these are a lot of the anticholinergics. And the antiemetics, we like to give them 30 to 60 minutes before surgery. Now, as far as chemotherapy-induced nausea and vomiting, that varies, but definitely one thing I say over and over again is that type of nausea is underreported and undertreated. So let's be kind to our patients with that. All right, here's the end of the road for us, and here's your little cartoon, so don't make me upset. You wouldn't like me when I'm upset. Have a great day.